must know facts and figures and techniques that only occasionally does the training venture into human values. Too little time is allotted for rumination on which values are right. Medical practice is concerned with what works, which treatment is most likely to result in the greatest medical benefit. Philosophers label that ethical approach to problems utilitarianism, focused on action and the outcome it spawns. Timeliness of interventions is often critical. There are 4 minutes to restore oxygen to the brain from the time a heart stops before permanent damage results. Medical staff must respond quickly. Often they must take action when information is incomplete. If the emergency room doctor were confronted with an unknown patient with cardiac arrest, resuscitation would be attempted on the principle, when in doubt, err on the side of life. Had the doctor known that the cardiac arrest resulted from widespread and incurable cancer, she would have made no futile attempt at resuscitation. But because important facts are lacking and consequences are not always predictable, moral decisions must be made on the spot, according to experience and the bias of an individual's values. Most physicians hold values that have been incorporated into their behavior before they arrive at medical school. Regard for the truth, inclination to help the less fortunate, putting self-interest aside, prioritizing sanctity or quality of life. These are difficult values to teach to an adult who has not already integrated them into his or her character. Experience in and after medical school may serve to affirm or modify the morality they have brought to their chosen profession. There is no code to which laypersons can refer to predict how any individual doctor will respond to requests for abortion, or pleas for euthanasia or assisted suicide, or how she will react to a patient's alternative sexual lifestyle. For over 20 years, I have been concerned with the way medicine, law, and morality become entwined, and how they then, uninvited and unexpected, intrude on everyday private lives. The questions of right and wrong are always with us and need constant weighing and balancing. These stories may help people to analyze situations in which, no matter which choice is made, some good will be left undone or some evil will be perpetuated. That is why ethics has been called the logic of tragedy. No one will meet all of these situations in their lifetime, but everyone can take away something of value from contemplating moral dilemmas. The mental exercise will stand them in good stead should they encounter quandaries of their own. I also encourage readers, in advance of a crisis, to consider how they might deal with these problems and to engage their doctors in serious conversation about personal values. There are some specific ethical underpinnings of medical practice, the codes and guidelines, theories and principles that aid but do not spell out decisions for doctors and patients. They are corrals within which ethical decisions may be found, rather than paths leading directly to the right answer. Moral compatibility with doctors is essential in order for patients to receive the kind of treatment they desire. Everyone experiences the periods of human transition, birth and genetics, with tragedies of abnormal births and developmental disability, sexuality, within and outside of marriage, reproductive successes and failures, illnesses and aging, attitude and gratitude between parents and children, and death and dying. And all are fraught with medical, moral decisions. Doctors, if they wish, may become mere technicians, offering their skills and knowledge as a commodity, simply selling whatever the patient wishes to buy. Very little ethical judgment need be employed. For some, it's easier that way. The stories I will relate are not about doctors who simply provided their technical skills. They are about doctors who went beyond that role in an effort to bring about what they believed to be the best outcome for their patients. But in so doing, they sometimes lied, betrayed confidences, or broke or stretched the law. You'll find some of them difficult to condemn and some difficult to condone. A few of them anticipated changes in the law that simply came about too slowly. Philosophers who contemplate certain injustices in the world often advise against precipitous action. Especially, they urge adhering to the law and social conventions.
To keep listening to this audiobook, I've left you a link in the description so you can do it at no cost thanks to Audible's 30-day free trial.